So there have been a number of interesting new findings. First, most importantly, is that the reduction in severe pneumonitis defined as common terminology criteria for adverse events, grade 3 or greater side effects, the rate of severe pneumonitis was more than twofold less with intensity-modulated radiotherapy compared to 3D conformal technique. This really builds upon what was previously presented in 2017. Other important findings were that despite historic concerns about the low-dose bath that's spread by intensity-modulated radiotherapy, so in order for intensity-modulated radiotherapy to conform dose to tumor and avoid normal tissue, it spreads what's called the low-dose bath. And there have been a lot of historic concerns that this low-dose bath might result in unexpected late side effects, and even possibly impact survival. There's also been a concern that the low-dose spread might portend an excess development of late secondary malignancies in the lung. Despite these historic concerns, the low-dose bath was not associated with the development of any kind of severe toxicity. And this is pneumonitis, hematologic toxicity, esophagitis, cardiac toxicity. Absolutely no evidence that the low-dose bath impacted any severe late toxicity event. Secondly, the rate of secondary malignancies between 3D conformal radiotherapy and intensity-modulated radiotherapy, roughly about 5 and 6% were virtually the same. So no evidence of excess second malignancy development related to that low dose bath with more than 5 years of follow-up. Third, on multivariable analysis, there was no evidence that the low dose bath had any association with overall survival. So, side effects aside, even though there was no association, what's even more reassuring is that there was no impact of this low dose bath on survival. Some of the other really important findings was that age was not associated with survival, meaning that we should not be discriminating against patients on the basis of age alone in terms of candidacy for curative intent chemoradiation, which is achieving long-term survival in quite a few patients these days as a result of the Pacific trials. So, very important that age alone it should not be considered a contraindication for chemoradiation. And then we also saw that the heart doses, the heart V20 through V60, were highly correlated with survival. And on multivariable analysis, we demonstrated that constraining the heart V40 less than 20% is a very important objective that is associated with a significant survival benefit. And we anticipate that the heart V40 constraint that we identified will have relevance to future radiation treatment guidelines, both nationally and internationally.